Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Down syndrome. Introduction. Down syndrome is a genetic disorder that causes mental and physical disability. Mental and physical development may be slower in people with Down syndrome than in those without it. It is named after John Langdon Down, the British physician who described the syndrome in 1866.
Down syndrome cannot be cured. Still, people with Down syndrome can lead happy and fulfilling lives.
This program explains Down syndrome. It covers the symptoms, genetic causes, diagnosis, and treatment of the disorder. What is Down syndrome?
Babies born with Down syndrome have an extra chromosome. Chromosomes are genetic materials in the cells of the body. Each human cell has 46 chromosomes. Genes on chromosomes determine how a baby's body forms and grows. Those who have Down syndrome have an extra copy of chromosome 21.
The extra chromosome 21 in babies with Down syndrome causes changes to the development of the body and brain. This results in mental and physical problems for the baby. People with Down syndrome commonly have other health problems caused by the extra chromosome. These can include a birth defect of the heart, eye problems, hearing problems, intestinal problems, skeletal problems, thyroid problems. Some specific examples of common health problems that affect people with Down syndrome include cataracts, celiac disease, dementia, sleep apnea.
People with Down syndrome have a life expectancy of more than 60 years.
Symptoms. People with Down syndrome have some physical and mental features in common. However, the symptoms of Down syndrome may range from mild to severe. Mental and physical development in people with Down syndrome is slower than in those without the disorder.
Down syndrome causes a distinct physical appearance. Common signs include a flat face and eyes that slant upwards, a large tongue, a short neck, a crease on the underside of the hand, ears with an abnormal shape. Other physical signs of Down syndrome include poor muscle tone, small hands and feet, curved pinky fingers, white spots on the eye in the colored area.
Down syndrome also causes children to grow slower. Often these children are shorter than other children of the same age. Children with Down syndrome also reach developmental milestones, such as sitting or crawling, at about twice the age as other children.
People with Down syndrome usually have mild or moderate intellectual and developmental disabilities. They may have delayed language. They may also have slow motor development, which is the ability to control muscle movement. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. To understand what causes Down syndrome, you need to understand how genes work. This is because Down syndrome is a genetic disorder. Genes tell the body to build certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also can affect our health. Genes are found on the chromosomes. Each person has 23 pairs of chromosomes. In other words, a person has 46 chromosomes in total. When a couple has a baby, each parent gives their baby one each of every pair of their own chromosomes. 23 chromosomes come from the mother's egg and 23 chromosomes come from the father's sperm. An extra chromosome causes Down syndrome. The extra chromosome is chromosome number 21. This means that a baby with Down syndrome has 3 number 21 chromosomes instead of a pair of 2. The 3 copies of chromosome 21 are called trisomy 21. A person with Down syndrome has a total of 47 chromosomes instead of 46. The extra chromosome causes the physical signs and additional problems that happen in people with Down syndrome. Prenatal testing. The chance of having a baby with Down syndrome increases as a woman gets older. Many healthcare providers recommend that women over age 35 have prenatal testing for the condition. This allows families to prepare for the baby's special needs. Screening tests during pregnancy may be used to determine if a baby has a high risk of having Down syndrome.
During the first trimester, a blood test and ultrasound can look for abnormalities. Your healthcare provider may recommend the quad screen during the second trimester. This screening test helps improve detection of Down syndrome. If the screening tests indicate that a baby is at high risk of Down syndrome, diagnostics done during pregnancy can confirm. The following diagnostic tests for Down syndrome may be done during pregnancy: prenatal cell-free DNA screening, amniocentesis, CVS. Pregnant women carry some fetal DNA in their blood. A blood test called prenatal cell-free DNA screening can look at the fetal genes to find out the risk of Down syndrome.
Done after the 15th week of pregnancy, amniocentesis uses a needle inserted into the mother's uterus to take a sample of the amniotic fluid. The amniotic fluid surrounds the unborn baby during pregnancy. The sample is analyzed to see if the baby has Down syndrome.
CVS stands for chorionic villus sampling. During this test, cells are taken from the placenta. The placenta is an organ that surrounds a developing baby and provides it with nutrients. The cells are analyzed to see if the baby has Down syndrome. CVS is done 10 to 13 weeks into the pregnancy. Amniocentesis and CVS carry a very low risk of miscarriage. Talk to your healthcare provider about the possible risks of these tests if you are considering them.
Diagnosis after birth. After birth, Down syndrome may be first diagnosed by a baby's physical appearance. A blood test can also confirm if a baby has Down syndrome.
Common signs of Down syndrome include a flat face and eyes that slant upwards, a large tongue, a short neck, a crease on the underside of the hand, ears with an abnormal shape.
Treatment. Down syndrome cannot be cured. However, with early treatment, many people with Down syndrome live productive and happy lives. Often, treatment for Down syndrome includes speech-language therapy, occupational therapy, and exercises to improve motor skills. During speech-language therapy, the speech-language pathologist works with the patient to help him or her create certain sounds. Speech-language therapy helps with speaking, understanding, reading, and writing. Occupational therapy helps people learn to care for themselves. It focuses on daily activities and improving self-confidence so that people with Down syndrome can be independent. Exercises to improve motor skills can help tone muscles that are weak. This can improve muscle control in people with Down syndrome.
Children with Down syndrome may be helped by special education. Many children are integrated successfully into regular classes.
Treatment for Down syndrome also includes medical care for health problems that are common in people with the condition. These treatments depend on which medical conditions a person has. Talk to your healthcare provider for more information.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Down syndrome is a genetic disorder that causes mental and physical symptoms. Usually, mental and physical development is slower in people with Down syndrome than in those without the disorder.
Genes are found on the chromosomes. Each person has 23 pairs of chromosomes. In other words, a person has 46 chromosomes in total. An extra chromosome causes Down syndrome. The extra chromosome is chromosome number 21.
Many tests that screen for Down syndrome are available during pregnancy. If these tests show that the risk of the baby having Down syndrome is high, diagnostic tests may also be done during pregnancy. After a baby is born, a blood test can confirm Down syndrome. Treatment for Down syndrome may include speech-language therapy, occupational therapy, and exercises to improve motor skills. Special education classes and treatment for specific medical conditions may also be needed. Down syndrome cannot be cured. However, with early treatment, many people with Down syndrome live productive and happy lives.
Thank you for using Explain.